Hey guys, welcome back to my channel, The Purpose Nurse. If you have been on my channel before, but if it is your very first time watching any of my videos, then welcome. So you can tell that it's dark in my room right now. That is because I literally actually just got back from eating with my classmates after clinical. Today was our last day of clinical, our fifth day. So I will be discussing with you all in this video how today went, as well as my fourth day of clinical. So if you are interested in hearing about how my last 2 days of clinical went in the ED and the OR, yes, you all, I went to the OR. It was pretty awesome. Then keep on watching. Okay, you guys, so we're going to do like a little flashback to my fourth day. So my fourth day, I was in the ED again, and it was pretty cool. I was able to see a couple of things. So one of the cool things that I saw, actually saw and was involved in, was a kind of like sim scenario. So one of the emergency physicians actually went through a simulation with the nurses on how to handle a cold blue. I guess they had a cold blue prior and it wasn't as organized as it could have been. So the physician really took out the time and literally walked through what things need to be set up, how when a cold blue does occur, how everything should flow. There shouldn't just be a bunch of people standing around. If somebody is trying to get an IV in the right arm, okay, then someone go try the left arm. Someone needs to be, holding the pulse on the patient to see if they can, feel it once the pulse does begin back. And normally he was saying that typically a resident is the one literally holding the patient, trying to feel for a pulse and things like that. He also took us into the med room and actually pulled these certain meds that you would use during a cold blue. He pulled epinephrine, amidate, and another one called succinylcholine. I'm probably like butchering the name, you guys, but it was along the lines of that medication. But basically, yeah, he discussed that. And for me, it was just really cool because when he was speaking, he wasn't just speaking to the nurses. He was looking at myself and looking at my other classmates that were with me, and really making us feel like we are a part of the discussion that he was having. So yeah, that was really cool. Another awesome thing was trying to see how the nurses troubleshoot when they have somebody that's a Heartstick. So the term Heartstick, for those of you that may not know, is basically when you get a patient that has veins that make it like really hard for you to put an IV. Maybe the veins are really deep or the veins roll. And typically, this could be if the person is maybe like obese or they are elderly. Those are just like, two examples of, why a person could be a Heartstick, or maybe they, are a substance abuser, maybe do some form of type of drugs and use their arm a lot, so the veins may be like hardened. There's just all types of different reasons why somebody would be considered a Heartstick. But this particular patient that we had, he had like multiple strokes, and so from those strokes he became contracted. And so basically when I say contracted, that means that his, limbs, his feet, hands were all kind of like in a like bent position, like, and just really tight, like towards his body. So you can imagine if you're trying to put an IV in a patient like this, is going to be, pretty difficult. And because the patient is contracted, he's not necessarily getting full blood flow to his extremities, like you and I, would be. So it was just, yeah, it was crazy really trying to see them get blood from him, because they needed to get labs and everything done to see what was going on with the patient. And I believe they did end up getting a really good vein in the patient's foot, like on the top part of the foot. So yeah, that was something really interesting that I also got to see. And something that was kind of like, I won't say upsetting, but I was kind of, like disappointed, was the fact that I wanted to insert more IVs. And the particular nurse that I was with explained to me that he liked to, do his own IVs and stuff like that, just in case, anything happened. He know that the IV was inserted correctly, and he wouldn't want to have to like go back and like have to reinsert the IV, because even though it may not have been busy at the time that I asked or initially brought up me wanting to insert more IVs, that maybe it would get busier, throughout that day in the ER. So I was a little bit upset, I'm not gonna lie, y'all, because, I feel like when you have an opportunity to insert an IV and refine these skills, like you literally have to jump at that opportunity, because you don't want to, get to a position where it's your, first time, inserting IV on a patient. Now that may happen, and if any of you are ever put in that position, don't tell your patient that it's your first time. Yeah, don't do that. Don't do that, because it may make them uncomfortable. You just have to be a boss and trust and know that what your professors taught you, you know how to do, and you got it. So I'm trying to think of anything else that happened on my 4th day. That was pretty much it. Oh, no, just kidding. So I got to see a thoracentesis done, and that's basically when you're withdrawing fluid, or you're puncturing a hole in the thorax and you're withdrawing fluid. So there was a patient that was in dialysis, and he apparently, well, they had called a code blue, but it really wasn't a code blue. He just became hypotensive, and hypotensive means that his blood pressure just dropped significantly low. So he didn't go into like a cardiac arrest or anything. So myself, my classmate, and the nurse, we responded to that. And once we saw that the patient was okay, we went back down to the ED. But when we got down there, we had heard that same patient was actually coming down to the ED. And so basically this patient had pericardial effusion. So basically what that is when you have fluid that has accumulated around the heart. And an abnormal amount of fluid has accumulated around the heart. So you have to pull that fluid out. So that was really cool. We watched the emergency physician literally, puncture the thorax area and withdraw at least about, 7 or 8 syringes with like fluid. Yes, you guys, that it was a lot of fluid that was surrounding this patient's heart. But he ended up being fine right after that. He experienced some relief, and his blood pressure slowly but surely begin to, increase and get within normal range. So that's it for my 4th day of clinical. That's pretty much everything that happened. So going into my 5th day, which was today was pretty awesome. So I got the opportunity to go into the OR, and it was absolutely amazing. We first met with the OR educator, and she basically gave us a breakdown of how the OR works. She gave us a breakdown of the different positions as it pertains to nursing. So they have a circulating nurse who basically is able to go in and out of the operating room and is not sterile. And then you have a scrub nurse who is basically working alongside the surgeon and handing him all the tools and things that he needs to, do his job, and actually setting up the sterile field. And she remains in the OR. And of course, she's sterile. And she just broke down how the OR works, the flow, making sure that you are staying hydrated, because in some of these surgeries you are standing. And mine in particular today, I was able to sit. So the surgery that I sat in on today was actually 2 surgeries, and they were cataract surgeries, and it was just really amazing to see the roles of the scrub nurse and the circulating nurse and the CRNA. So CRNA stands for Certified Registered Nurse Anesthetist, and CRNAs basically are in control of sedation for the patient. And so for the cataract surgeries that I saw today, the patients were awake. They still did have a moderate amount of sedation, but they weren't completely sedated, because that obviously would affect them, keeping their, eye open for the cataract surgery. There was an instrument that the surgeon put to keep the eye open, but this is a fairly quick surgery. Maybe about 25, maybe 30 minutes, the surgery is done. So it was pretty cool, putting on the scrubs and the hair nets and the mask, and just literally watching the surgeon work and watching the scrub nurse hand the different instruments to the surgeon, and just hear the conversations, stuff that they have, because you don't think that like during, a surgery that like they're like casually talking and things like that. But these individuals are so used to doing these surgeries, they know what they're doing, that I believe that it actually helps them, remain comfortable and calm during the surgeries, because they're able to talk about different things and just have casual conversation while they're performing the surgery. So yeah, that was amazing. Seeing the cataract surgery, and for those of you who don't know what cataracts are, it's basically like when the lens of your eye gets blurry, like pretty much like if you think of like a dirty windshield, is like it becomes like hard to see. And some people get them, as you get older, just from aging, and it eventually becomes very troublesome, to see. So your vision is very, skewed. So they would basically take out the lens and put a new lens in, a lens implant. So I was able to see that. So then after that, I went back to the ED. So I was at the ED a total of 3 times during my entire clinical. I'm so grateful for that. And when I was in the ED today, I was able to insert an IV, and it was amazing, you all. I was so happy. Like, I chose a good vein. The vein was really juicy. I, inserted the catheter. It was literally, y'all, it was like effortless. Like, I was focused when I did it, you know, but it was effortless. And it was just really, really, really awesome to see. I also learned today how to do nebulizer treatment, which is fairly easy. Was able to do that. And I also drew blood for bacterial cultures to see what bacteria is present, or if there is any bacteria present in this specific patient's blood. And yeah, like, that's all that happened today. Wait, I'm missing something. There also was another cold flu that happened today. There's actually an individual that was like in the gift shop of this particular hospital, and they like got lightheaded and kind of like fell out. And so when things like that happens, at this particular hospital, the ED is like expected to respond, and they have like certain individuals that are on I can't remember the name of the team, that are on the specific team that respond to situations like the one that happened today. And so as we were going down the hallway with our nurse, the charge nurse of the ED was actually pushing the crash cart. And so she said to myself and my classmate, like, oh, you guys can push the crash cart. So it's pretty cool. Myself and my classmate are like going down the hallway, pushing the crash cart. And we both were like, this is so cool. So we get to the gift shop, and the patient is surrounded by residents, attendings, pharmacy, everyone that is there during our normal code is like there. And so they realize that the patient is okay. So the patient gets put on the gurney, and we take him back to the ED, and we admitted him. So yeah, so that's a combination of my 4th day and today, which is my 5th day. And yeah, that sums up my clinical series for my Med-Surg, ED, and OR rotation. Overall, I really, really, really loved this hospital that I was at this quarter. It was so amazing, and I just got to do so much hands-on stuff and learn new skills and strengthen other skills. It was just really amazing, and I just feel really grateful for the field that I'm going into. So yeah, you all, I hope for those of you who are interested in nursing, I hope this video has helped you. And for those of you who are about to start the MECHAN program, or for those of you who are thinking about nursing but not really sure. And lastly, for those of you who know someone that is interested in nursing and has always wondered what clinicals are like, or more specifically Med-Surg clinicals, or clinicals in the ED, or what an experience would be like in the OR. So yeah, if you like this video, please give it a thumbs up, you guys. Thumbs up, thumbs up, thumbs up. And I will see you all in my next video. Be purposed. Bye.